If you wake up with a nasty virus on a Saturday morning or at night and your doctor's office is closed, what do you do?
Western Connecticut Medical Group has the answer. Now, telehealth and the night nurse service are conveniently designed to extend patient care access beyond the regular office hours.
So stay tuned, we're up next. Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today we're talking about telehealth with Dr. Andrew Keller. He's Chief Medical Officer with the Western Connecticut Medical Group.
Thank you so much for joining us, Andy.
Great to be here.
Great
Thanks.
to have you on the show. So start our viewers off by telling them a little bit about what telehealth is and kind of what conditions can be addressed by it.
So telehealth is really the ability to communicate between a doctor and a patient over wide distances. It involves both audio and visual.
So this is the next step beyond the telephone.
It's the next step beyond the telephone. It's like FaceTime. It's like Skype. It's like really, it's like us talking, but in fact we're talking over a device.
Let me ask you the question, as a physician, how important is that visual access to care? Because, we're all used to, for the last 30, 40, 50 years, talking to people on the phone, making tentative diagnoses, sending people, I don't know, for a decongestant for their cold. What added dimension does this bring that allows us to make this a more meaningful visit?
I think it's huge, Eric. Just sometimes, you hear a story about a patient and you walk in the room and all you have to do is just look and you see something that makes such a huge difference in your ability to manage and treat the patient. So it's really very important.
It really emphasizes the physical exam, part of which is looking at the patient. Probably one of the largest part is just looking at the patient and seeing how sick they look,
right,
how they respond, etc.
Right, and there's a culture too of trying to to overcome that, both from the patient side as well as from the physician side. Can you really do this? Can I really treat a patient over audio and visual? And there are.
And I think it's important to remember that it's bi-directional, so the patient can see the physician,
right,
as well,
right,
and see their facial expressions, and that I think is huge as well in a relationship.
Right, and there's a very important part of communication that involves facial expressions and looking at people and talking to them as well. So it's much more important, I think, than we really have made it out to be. The telephone really hasn't added much, but this has added a tremendous amount to our ability to take care of patients.
I think that's
so what conditions are we currently using telehealth to actually treat? We're not talking about this seriously ill person that belongs to the emergency room.
Correct. So, it depends on which state you're in and how far advanced you are in terms of providing telehealth. For the most part, in the state of Connecticut, most of us are using telehealth really to do minor illnesses. Colds, rash, flu-like illnesses, sore throat. Those are the things that we're adapting to telehealth.
This is sort of what the walk-in centers are
Probably,
seeing.
right.
So this is a way for someone to see their own medical practice as easily as they could go to a walk-in around the corner.
Right, and so what we've done at Western Connecticut Medical Group is provide our patients with a doctor, their medical records, so that those are available at Saturday at noon when your office is closed, or at night when your office is closed. So it's very much an extension of your existing office, giving you that access at any time that you need it.
I think that's huge, and that makes it really distinguishes it from most walk-in centers, is that the doctor who's seeing you has access to your records, to
Correct,
what's happened to you in the past, to your list of medications.
Yeah, so this is not a service for new patients that are not already part of the medical group, is that
Correct.
right?
Right.
So this is, by the way, while we're talking about the Western Connecticut Medical Group, this is something that I think lots of medical groups will be adapting across Connecticut. So I think it's very interesting to see the way it's being done here, because it really does represent the future. So these are patients, just to get some idea, these are patients already seeing primary care physicians or
right,
specialist physicians within the medical group.
Correct.
And those patients know who they are. And then they have a problem. They have a really sore throat or a headache, and they call at 5 in the afternoon, and office hours are just ending. So what do they do? What happens?
So we'll make an appointment for them over telehealth, and they'll make an appointment at 5:30 to see a doctor, and they'll see someone, and just like you were sitting in the room with me.
Do they call the doctor?
So you go into a virtual waiting room. You open up your iPad or your tablet or whatever you have. You can do it on a laptop as well. And
No, is there a special app they use?
There is.
So they go and they download an app that I presume creates confidential communication.
Correct.
And
so if you go to our website, live.wchn.org.
Live, live.wchn.org.
Correct. You'll see some information about telehealth, payment, what's covered, and then there's a little button that says Start Telehealth Session. If you're on a tablet, it'll take you to download the app, and you start the app, you put in a service code, and you're in our virtual waiting room. You can see.
Now, what happens in the virtual waiting room? Do
So
they play music? And
so there's a little bit of
and
instruction.
offer coffee?
Yeah, coffee, absolutely, always offer coffee. But there's a little introductory video about what telehealth is. You'll see the doctors or physicians or APPs, the providers that are there. And then when one's available, they turn green instead of being orange if they're busy. And they know you're there, and then they'll hook you up for a visit.
That's great.
And your medical record is available to that doctor.
Absolutely.
When he or she is seeing you.
Right.
Is it always a doctor, or do you sometimes have a nurse that answers the phone?
So we'll have a nurse practitioner at times, or a PA, or a physician, but not just a registered nurse. So these are people that can treat you as if you came into the office to be treated.
I think we have a graphic to bring up
With
showing
the
kind of
hours
the hours
that
that
this
this is available.
What hours do you typically make this available?
So this is available between 8 o'clock, I think it's 10 o'clock to 10 o'clock on Saturdays and Sundays, and available between 5 o'clock and 10 o'clock during the week.
Great. And tell us a little bit more, in addition to kind of urgent visits,
Right.
Are we using this, are folks using this for follow-up visits as well?
Right, so we've actually expanded into several other areas that are not urgent primary care, and these are more routine visits. So we have one practice that's doing routine follow-ups for primary care. We have many of our psychiatrists doing follow-up visits with telepsychiatry. And that's a tremendous advantage to patients. They don't have to drive to a waiting room. They don't have to be seen. It really allows privacy. And they can, in their own home or office or wherever, have their session with their therapist over telepsychiatry and really avoid the travel and everything else, and really add a tremendous value in terms of privacy.
These are real bona fide office visits.
They're real office visits.
In every sense of the word.
They are. They're just as if you and I were talking, but we're talking over
Do we have the
technology.
capacity, if I want to listen to your lungs, to do that at this point?
So there are facilities where you can do that. You can go into a room, and there are ways to transmit the lung sounds or heart sounds over telehealth. We're currently not doing that. We figure if that's what you need to be seen for, if that's the nature of it, you really probably should be seen in an urgent care or a doctor's
But I would
office.
think things like diabetes management, where close follow-up's important, but examination at every other week is not as important.
Correct.
That could be done very, very effectively. You know what the blood sugars are. You know
So
what the
we're expanding actually into diabetes, endocrinology, and pulmonary. So those are the two areas where we're trying to set up visits as if you were in the office. And in pulmonary especially, these patients, many of them are older, debilitated. It's a whole ordeal.
Very
to
hard
come
to get out of
right,
the house.
To get out of the house, or a daughter has to take off from work.
Well, just think geriatric visits would be another,
Right.
another possibility there.
Absolutely.
So it really adds a tremendous amount to patient access.
I know there's a new program, but what has been the reception on the part of both the patients as well as the physicians?
So there's a culture change, and it takes time. But once someone has a telehealth visit, their feedback has always been the same. That was great. I can't wait to do it again.
What do people like about it?
Just the convenience. It's just, it's convenient, and you just don't believe how convenient it is. There's a little bit of training we have to do with our physicians, make sure they look at the camera. But it's very much like being here. It's the same thing. So there's minimal training for physicians. They do have to get comfortable for a little bit, and that's a culture change. But the patients immediately latch onto it.
And again, because it is a real visit, just like if you were coming to an office, the physician makes a note of that visit that goes into your medical record.
Right.
The computerized medical record.
That's right. But otherwise, that video is not recorded in terms of
No,
patients
Right, so,
confidentiality.
all of the telehealth applications throughout the United States, no one records audio or video. It's never maintained. It's just simply as if you were on a telephone with someone. No one's recording that conversation. You know,
How about hackers? Have they had any success so far in getting into these systems? Because the app presumably gives you a confidential link with the doctor, so that nothing should be available. But
Right. So the amount of effort it would take to hack into one of these systems is massive. It would take a tremendous amount of effort, and I'm not sure what you would get from it. You know, you'd be able to listen to you and I talk about, you know, my cold or whatever, right? So it's such a low yield, and it would require so much effort. It's really safe that no one's actually doing it.
I'm sure our viewers are wondering, what about insurance coverage?
So because Connecticut has a state law that requires telehealth to be paid as if you were in an office visit, it's covered as if it was a standard office visit. So all of the commercial payers within the state of Connecticut have to reimburse both your physician and charge you the same copay as if you were sitting in the exam room with the doctor.
Medicare, I understand, is not on board with that idea yet.
So Medicare hasn't adopted to that idea yet. There's a lot of conversation talking about it, but it really hasn't adapted to that. It has adapted to having you seen in a hospital and another physician in another hospital, but not at home. And that's the difference. And I think that probably within the next couple of years that will be covered.
One more expectation that hopefully our government will keep up with the changes that are happening.
And that's a population that really benefits from it, who have limited access, who can't get out, who are homebound. I mean, that's really where you'd want to explore that. We're also exploring using it in skilled nursing facilities, again, same reason.
Right.
And do you ever combine that with sending X-ray people or laboratory people into the home to gather more information? Is there a way to really care for a homebound patient who needs some additional testing?
There is, because typically what we would do is if we were going to go into a homebound patient, we'd go with a nurse, and the nurse would bring the telehealth apparatus and have the conversation, set it up for the patient, would help you complete part of the examination, maybe weigh the patient, take vital signs, draw blood, and you'd be able to interact with the patient. And so that's how that would occur with, you know, a human, a nurse, someone who could help facilitate the visit.
And it seems to me once we move away from fee-for-service type of reimbursement into more of a global payment, that we'll be able to be even more creative in terms of applying these new technologies to care.
Yeah, absolutely. I agree with that. Yeah, that's a change that will happen slowly, but sure.
Well, for more information, we have a graphic we'd like to bring up because it's such a fascinating topic.
Again, where should patients go for more information?
So for more information, all the information about telehealth in the offices is handed out at the office. So when you're in the office, ask about it. We have brochures. We do have our own website, live.wchn.org, where you can go to and get more information.
So somebody's just watching this broadcast and would like to learn more just out of curiosity can go to live.wchn.org.
Correct.
Are other groups beginning to use this around the state?
Absolutely.
So this is the new medicine.
It's the new way, right? Yeah, and it's going to take time, but I think as people realize the benefit of it, it'll grow.
Yeah, enormously convenient, and again brings a lot of expertise to focus on that patient without a lot of effort on that patient's behalf. I want to thank you so much.
Thank you very much for coming on the show.
That's all we have time for today, unfortunately.
Amazing.
I want to thank our guest, Dr. Andrew Keller, for coming on the show. Thank you, Andrew.
Thank you.